Hello friends, welcome back with another video. In this video I am going to discuss with drugs of choice for all cardiovascular system disease. So let's get started. Drugs of choice for torsades de pointes is magnesium sulfate. Drugs of choice for dyslipidemia is Hmge CoA reductase inhibitor. Drugs of choice for hypertriglyceridemia is fibric acid. Drugs of choice for myocardial infarction pain is morphine. Drugs of choice for mild hypertension is diuretic. Drugs of choice for the hypertensive crisis is nitroprusside. Drugs of choice for hypertension with BPH is progestin. Drugs of choice for hypertension with ischemic heart disease beta blocker. Drugs of choice for hypertension with diabetic mellitus is ACE inhibitor. Drugs of choice for hypertension with diabetic nephropathy is also ACE inhibitor. Drugs of choice for hypertension in young patient is ACE inhibitor like captopril. Drugs of choice for unilateral artery stenosis is ACE inhibitor. Drugs of choice for hypertension with renal disease ACE inhibitor. Drugs of choice for hypertension is CHF, so also ACE inhibitor. Drugs of choice for hypertension in non-diabetic proteinuria is ACE inhibitor. Drugs of choice for hypertension in asthma is ACE inhibitor. Drugs of choice for hypertension in patient with ischemic heart disease is beta blocker. Drugs of choice for isolated systolic hypertension is CCB, calcium channel blocker. Drugs of choice for low renin hypertension also calcium channel blocker. Drugs of choice for hypertension with bronchial asthma ACE inhibitor or calcium channel blocker. Drugs of choice for hypertension with chronic kidney disease ACE inhibitor. Drugs of choice for hypertension preferred in older patient thiazide. Drugs of choice for digoxin overdose is Dizifavor, Digivind. Drugs of choice for group B streptococcal infection ampicillin. Drugs of choice for endocarditis is amoxicillin. Next one, drugs of choice for digoxin toxicity is potassium. First line drugs of choice in CHF is ACE inhibitor like captopril and alpril. Drugs of choice for rapid fast diuresis is loop diuretic. Example, furosemide. Drugs of choice for multifocal atrial tachycardia is beramapryl, calcium channel blocker. Drugs of choice for paroxysmal supraventricular tachycardia is adenosine, which one is the antiarrhythmic agent. Drugs of choice for supraventricular tachycardia is beramapryl. Drugs of choice for digitalis induced ventricular arrhythmia is lignocaine, which one the antiarrhythmic agent. Drugs of choice for ventricular arrhythmia lidocaine. Drugs of choice for ventricular tachycardia and fibrillation lidocaine. Drugs of choice for ventricular extrasystole is beta blocker, examples like atenolol. Drugs of choice for atrial fibrillation digitalis. Drugs of choice for maintaining sinus rhythm is amiodarone, which one also antiarrhythmic agent. Drugs of choice for Wolff Parkinsonism White syndrome is procainamide or amiodarone. Drugs of choice for digitalis induced arrhythmia lignocaine. Drugs of choice for acute left ventricular failure IV furosemide. Drugs of choice for the scleroderma induced hypertensive crisis ACE inhibitor. Drugs of choice for acute long QT syndrome is magnesium sulfate. Drugs of choice for congenital long QT syndrome beta blocker. Drugs of choice for hypertension with peripheral vascular disease is calcium channel blocker. Drugs of choice for the hypertensive emergency is sodium nitroprusside vasodilator. Drugs of choice for malignant hypertension nitroprusside vasodilator. Drugs of choice for producing controlled hypotension is sodium nitroprusside. Drugs of choice for pulmonary hypertension is bosentan. Drugs of choice for atrial flutter and fibrillation is ibutylide. Drugs of choice for paradoxical tachycardia is digoxin. Digitalis glycoside. Drugs of choice for angina nitrate vasodilator. Drugs of choice for prophylaxis of stable angina beta blocker. Drugs of choice for variant angina calcium channel blocker beramapryl. Drugs of choice for diabetic dyslipidemia is statin, atorvastatin and rosuvastatin. Next one, drugs of choice for this beta lipoproteinemia is fibrate, fenofibrate. Drugs of choice for severe hypercholesterolemia is nicotinic acid. Drugs of choice for severe hypercholesterolemia is rosuvastatin. Drugs of choice for lowering TAG levels is fibrate. Drugs of choice for lowering LDL cholesterol level is Hmge CO reductase inhibitor. Drugs of choice for the cardiogenic shock with renal failure is dopamine. Drugs of choice for rheumatic fever, benzathine penicillin. Drugs of choice for increasing HDL cholesterol, niacin. Drugs of choice for pulmonary edema with congestive heart failure is furosemide, which one the loop diuretic. Drugs of choice for rheumatic fever, benzathine penicillin. Drugs of choice for TOF, tetralogy of fallot is morphine. Drugs of choice for reducing mortality in CHF is spironolactone. Drugs of choice in inotropic effect dobutamine. Drugs of choice for a hypertensive patient with benign prostatic hyperplasia is alpha-1 blocker like prazosin, tirazosin, doxazosin and alfuzosin. Drugs of choice for perioperative arrhythmia esmolol, which one is the cardioselective beta blocker. Thank you.